I'm sure my audience is curious to know as to what happens during the process of labor as you go through labor. So, when we see that you are into the active phase of labor, you are ushered into the labor room, the labor unit, and you are rested on the birthing cot. So, the first question may be that how long will it last? I think I just spoke about it, about anywhere between 6 to 18 hours is the total duration. The active phase may be around 6 to 7 hours. Now, are you allowed to eat something and drink something? Yes, you can. So, towards the early phase of labor, when your cervix is about 4 or 5 centimeter, you can eat small bits and make sure that you're not having a heavy kind of a meal. And we encourage you to keep drinking some liquids and juices throughout. You're allowed to do that. Now, other question may be whether or not you can move about. So we allow you to move. In fact, we encourage you to move about, to get up, take the small walks. That is best suited as your cervix is dilating, that you change your posture and to know in what position you're going to deliver. You can choose any position of your comfort, but then we encourage you to lie down on your back and fold in the time when you're delivering, your legs are folded onto your abdomen, and you can support your thighs with your hands, and that is how you can best push. But if you have a preferred way of pushing, or you're finding it difficult to push this way, you can choose your own comfortable position. Also, to know, if you know, we have all heard about these cuts that are given during labor. Is it mandatory? To ease out the birth canal, especially in the first time mothers who are going to deliver for the first time, it may be required. But if you have a stretchable kind of vagina, which you have done your perineal massages and you've learned how to your Kegel exercises, sometimes it stretches well enough and your baby is average size, then you may not need a cut at all. So especially people who are delivering, having a normal delivery for the second or the third time, many a times it is not given. But in that effort, sometimes the perineal muscle can have a small tear by itself, which is also repaired in the same way as a episiotomy wound. Now, what about complications? If you're concerned about complications that come with normal delivery, if you are adequately monitored, there may not be anything, but these are things that may unfold in the very last minute, like a brisk hemorrhage, about the atony of the uterus, when the uterus is not able to contract and retract after birth, or sometimes it can be a placenta which is stuck badly and does not get delivered out easily. So these are the complications that can happen. But then if you think of the advantages, that is, you recover very soon after a normal delivery, and you come to hold your baby, and you may start even feeding the baby very soon, and you can have a birth plan when you come to us. You can ask for a skin to skin contact, or your baby being given to you at your breast. So these are the things that you will really miss out on when you've had a cesarean delivery. Now, the other question is, can you have a normal delivery after a cesarean for the first time? Say this is the second one, I'm sure you're curious to know. So it will also depend on the reason for why the first cesarean was done. Suppose they said that it was a contracted pelvis, or there was some problem like that which is inbuilt in you. Then we cannot ask you to deliver normally. But most of you can deliver normally even after one cesarean birth. This is called as vaginal birth after cesarean, or VBAC. Now, here, if the first time you had a cord accident, or the baby was in breech position, and that's why they did a cesarean, and the second time story is different, you can very well go ahead and discuss it with your gynecologist for a VBAC.